Thank you so much, Rick Olderman, for coming on Wellness Your Way. I'm thrilled to have you here.
I am so excited to be here, Megan. Thanks for having me.
Well, I'm already excited because you've given me a preview of some of the things we're going to chat about today, and I know it will be a wealth of information for our audience. And I've read your formal bio, but could you please tell the audience a little bit about you to get us started?
Yeah, we'll edit that down a little bit. I'm a
Okay.
physical therapist. I've been a physical therapist for about 25 years, and by necessity, I ended up focusing more on chronic pain than anything because that's the greatest need out there.
Yeah.
And to that end, I wrote a series of books, the Fixing You series of books. They've been available on Amazon for about 10 or 15 years. And then recently, and I owned my own orthopedic clinic here in Denver. And then recently, I created downloadable home programs to help people solve their pain. And then I've got a new book coming out in 2023.
Oh, amazing. You keep yourself busy or your schedule full, as I prefer to say.
Yeah, well, there's a huge need out there, so I'm trying to
There
fill it.
is.
Yeah.
There is. And let's talk about that. I am hearing more and more about people who are experiencing with chronic pain. And of course, coming from the nutrition side, I have some theories on health and nutrition and inflammation and all of that. But I suspect you have even more theories than I do. So why do you think people are dealing with more pain than ever today?
Well, I think one of the things is that I don't think we in medicine do well with chronic pain.
Mm,
First of all, I think part of that has to do with how we're trained. I can only speak for physical therapists.
right.
So really, the gold standard for research in medicine is that you need to generate research, and in order to generate research, you need to focus on one thing in the body
Hmm.
and isolate that so that you can
Yeah.
test that, right? And that works well for more acute or smaller, cellular changes and responses to medications and so forth. But when you're talking about human function, it
Hmm.
doesn't really work like that. You
Yeah.
can isolate maybe a little joint, but that doesn't really tell you about how that joint is responding to the rest of the body.
Yeah.
And so most of the research out there is this is what I call component thinking, is
Mm,
that we've broken the body down into small components.
yeah.
And basically, it's been left up to us as physical therapists to put that together as a system again.
Right.
But there's no guiding principles about how to do that. So
Hmm.
we have all of this disparate information out there about, oh, you've got shoulder pain, let's look at the shoulder. You've got back pain, let's look at the back. But there's nothing to say, well, what if there's a connection between that back pain and that shoulder issue, or that foot pain and your neck issue? And
Yes.
so, and the problem is that we have not been trained as physical therapists to see the system's connections. But that's, by necessity, that's what I've been forced kind of to focus on in my last 25 years, is putting all of this together into a cohesive model that can, quickly identify the sources of pain and solve it.
I love this. Of course, my brain's going to nutrition, and it's the same problem I have with nutrition studies where we'll isolate a bioflavonoid or a vitamin C or something, and they'll do all the research on this. And I'm like, well, no one just consumes capsules of vitamin C all day. Like it's the confluence of other factors in the orange or in the whatever that all helps it work together. And what you're saying is, if we just isolate a joint in terms of physical pain, we're missing the whole picture of how the body works together. This is so, it sounds obvious and profound at the same time. I love what you're saying. Um, how do people, if they're experiencing that joint pain and they think, okay, it's just the elbow or it's just the back or whatever, how do they get to the root of why they're having this pain?
Yeah, well, before I answer that, let's include a little bit more into this idea of chronic
Sure.
pain too,
Love
since you
it.
brought up dietary issues. So I've developed over time a theory that there are three issues that are pushing us. Let's say we all have some threshold above which we have pain.
Yes.
Yours may be here, mine might be here, but wherever it is, it is.
Yeah.
And so there are three things that seem to push us up towards that threshold.
Okay.
One are musculoskeletal issues, which is what
Mhm.
I primarily focus on.
Right.
The other is dietary issues, allergens, mold
Mhm.
ingestions, things like that, that create an inflammatory response that generate tension in certain patterns in the body. And the
Yes.
third is psychological, emotional, or traumatic experiences that also create tension in the body in certain patterns of issues.
Yes.
So for someone to get down to the root cause of their, say, elbow pain or back pain, well, first, it could be a combination of these three issues. But from simply a musculoskeletal standpoint, my bet is that anyone listening who has chronic elbow pain or back pain or any kind of pain has probably already sought treatment for it, and that treatment has not helped them.
Yeah.
So the knowledge that that treatment is looking at them more from this component standpoint, I would suggest then to look larger.
Yeah.
That that elbow or back issue is really not the culprit, but the victim in the whole system of things. And so that's your weak link. The problem links are elsewhere that are feeding into that vulnerable point.
So interesting. I love this. So I am 99% sure I'm following what you're saying, but let's make it super concrete and specific. Let's say someone comes to you with sciatic pain, which I know is common. You mentioned to me before, one of the most common. So you're saying it's not necessarily something wrong with that specific area of the body, but it could be a chain of musculoskeletal issues or imbalances. Like what? Give me an example.
Yeah. So I've got my little skeleton out here for those of you interested. So sciatic pain, or let's say unilateral back pain or SI joint pain that's occurring in one side of the body, typically has to do with this pattern where one side of the pelvis is higher and one side of the rib cage is lower. I call this a side bending problem. Because it's basically your side bend, right? To one side. And what that does is it creates compression on that side of the vertebra or the spine on that side. And so the sciatic nerve roots are exiting from those spinal levels. And so that's increasing compression on those spinal levels. So this is really easy to solve. And most people are told, though, that they have a leg length discrepancy that's causing their sciatic pain. It's not a leg length discrepancy. It's a body's side bending problem, which makes it look like one leg is higher than the other.
Interesting.
So why is the side bending problem occurring, though? Well, that's typically a response to some problem, older problem, in this usually the same side leg. So what happens is we have these hardwired reflexes that we're born with. One of those is called a trauma reflex pattern or a withdrawal reflex. And you can watch videos of this on YouTube with babies. You have that, someone puts their foot down and they withdraw the foot because it's an unpleasant stimulus. But they're not just bending their knee when they withdraw that foot. They're hiking the whole pelvis up to withdraw that foot. So a withdrawal reflex pattern involves a whole side of the body to remove that from the stimulus. Well, the muscles that are lifting the pelvis up also attach to the rib cage. So when the pelvis is coming up, those same muscles are tugging down on the rib cage, which then causes the side bending problem.
Interesting.
So the thing that a lot of people miss is that we're not trained or we're not taught to think that, oh, you know what? I had that old sprained ankle in high school football or lacrosse or whatever, volleyball. And, it was the same ankle as the side I'm having sciatic pain on. I wonder if there's a connection. And we're not taught to think that because we're not taught to think of things in terms of systems, right?
Yes.
We're taught to say, oh, well, I got over that, so it must not be bothering me.
Right.
But the reason you got over it may be because you started to develop minor compensations to compensate for that. And so over time, those compensations get deeper and deeper and deeper. And then one day you end up with sciatic pain.
Yes. So interesting. So let me try to rephrase for the audience and make sure we're on the same page, and also try to describe what you showed with your skeleton. So when Rick is referring to side bending, it's almost like if you try to put the bottom of your rib to the top of your hip on the same side, just like do a little side crunch. And that's what he's showing. That's the side bending that is causing this sciatica in many cases. And this could be a learned response basically from either an old ankle injury or even just like as a baby, that might just be our natural instinct for whatever reason to clinch up one side. And our body learns that over time to protect us, but then it ends up kind of causing this impingement or this pain because of the compression. Is that kind of right?
That's pretty close. I like that description. So to
Okay.
get even closer to what I'm calling a side bending problem, if
Great.
folks stand up at home right now and they get up, call it your left foot. Go
Okay.
up on your tippy toe on just your left foot, and
Okay.
you'll feel that whole left hip has hiked up. And
Yep.
you'll notice instinctively your left shoulder has dipped down because you're
Okay.
trying to
Yeah, I
remain
see it.
level,
Yeah.
right? So that's a side bending problem on your left side,
Ah,
and that's what's causing usually unilateral back, sciatic, or SI joint pain, and it's due to some older injury on that side. So another easy way to figure this out in you is to simply just take off your shirt and have someone take a picture of your back. And
oh,
usually there will be a larger crease on the side of the side bending uh,
interesting.
as the other side. That will confirm that this is a side bending issue that you're dealing with at the root of your sciatic or SI joint or back pain issue.
That's so great. I have never taken a picture of my back. I'm definitely going to do that. And luckily, knock on everything, I've never had sciatic pain, at least for more than like 30 seconds or something like that. But this is a long story that I'm going to make 30 seconds. I had a really bad blister one year on my foot. I started compensating and running. I ran it into a stress fracture because I was just kind of not paying attention to my body and wanted to keep running through this terrible blister. And even still, I noticed myself trying to lift up that part of my foot. This has been years ago. There's no injury, there's no pain, nothing like that, but it's still kind of deeply ingrained in me if I'm not conscious of it. So maybe this is related to what you're saying. Our body just learns that response.
Absolutely. And it's not your body that's learning, it's your brain, right?
Ah,
The
okay.
master controller. And
Yes.
I mean, I had a client who had a hip replacement, and 3 years later, he's still limping on the same hip
Wow.
because he had spent 8 years limping up until that hip replacement surgery, and he
Oh,
couldn't unlearn that behavior very rapidly, no matter how much I nagged him.
really
Yeah,
interesting.
yeah.
So you have said the key to fixing all of this is fixing how we use our bodies. So tell me
Correct.
what you mean by this and how this is all related.
Yeah, so how you're using your body is what led to that initial ankle sprain or blister in the
Hmm.
first place, and
Yep.
it's what's leading to the compensations that are occurring in this, as a response to those issues. So
Yes.
I'll take your listeners through a really simple. So what we've just described, there are basically three patterns of issues causing almost all back pain. We've
Okay.
just described one of them, which is a side bending problem.
Yep.
The second common one, and this will kind of get to your answer. The
Great.
second common one is I call it an extension problem, but it
Okay.
really just means that there's too much arch in the low back,
Oh, I do
or
that.
yeah,
Yes.
or there are too many forces pulling on the body, trying to pull it into more of an arch.
Ah, okay.
So let me show you what I mean by this. So if everyone at home listens and follows this little instruction, and if you have back pain, this will tell you what the root of your back pain is right now. So we're going to have you lie on the floor with your legs straight.
Okay.
It doesn't have to be on the floor, but generally a firmer surface is more helpful. If it's your couch, then lie on your couch or your bed or whatever. But I want your legs straight for a few seconds. And I want you to feel how your back feels in this position. And if you like, you can even slide your hand behind underneath your low back to feel that arch in your low back in that position. So get a sense as to whether your back feels comfortable here. Now, what we're going to do is now bend your knees so your feet are flat on the floor. And if
Okay.
you don't feel a difference in your back comfort, then go ahead and hug your knees to your chest and see if that feels better for you there. Okay, so one of these two positions is going to feel better for you, either legs straight or knees bent. 99% of the people listening will say knees bent feels
Okay.
better for my back. Okay, the obvious answer to this would be, oh, it's because my back is flatter. That's why my back feels better when my knees are bent. But really, what it is when your legs are straight, there are the muscles that attach from the legs to the pelvis are tugging on the pelvis,
Mm,
causing then the back to arch more. And
okay.
when we bend our knees, we're removing those forces from our legs that are acting on our pelvis and back get to return back to its more normal position. what it
Mm.
wants to be in. Does that make sense?
Yes. And is that
Okay.
because we all have tight hip flexors because we're sitting too much?
Well, it's part of the reason, but
Okay.
it's not the hip flexors you might be thinking about.
Okay.
It's the thigh muscles. And so
Oh, okay.
let's
All
go
right.
into this a little
Keep
bit, because
going.
the thigh muscles are hip flexors too.
Okay.
So now everyone stand up and listen to the rest of this podcast.
Okay.
And what you'll notice is that after a minute or two, you're going to notice that your knees start to lock backwards.
Mm.
Okay. This is an energy conservation move. If my knees are locked backwards, I no longer have to use my muscles to stand up, and I can do so passively without exerting a lot of energy.
Okay.
But if you're standing up, are you standing up right now, Megan?
Yes.
Yeah, you look like you are. So go ahead and lock your knees backwards, and you'll feel
Okay.
that.
Yep.
Now, feel what your back feels like in this position. And now simply unlock your knees just a little bit, and you'll feel how your back just changed. And if you're not sure,
Definitely.
lock the knees again, and you'll feel definitely what's going on with your back.
Yes.
So your back arches more when your knees are locked, right?
Yes, for sure. I felt that.
Okay. And when you unlock your knees, it removes some of the forces trying to cause your back to arch.
Yes.
So we just found out that the lying on the ground portion of this test, that your back doesn't feel as good when it's arched. And now we just found out that when you stand more than a minute or so, you tend to lock your knees, which is causing your back to arch more.
Mm-hmm.
So this is the whole basis of my approach, is understanding these things that you're doing that are causing the patterns of pain to occur in your body, and
Yes.
then getting to them. So if you simply, and I've solved so much back pain just by getting people to unlock their knees when they're
Wow.
standing and walking. I guarantee that if anyone listening to this with back pain unlocks their knees over the next 3 days, they should probably feel between a 25 to 50% reduction in their back pain just by unlocking their
Amazing.
knees. It's that important. Some people, it's 100%,
Mm.
because that is the primary stressor that's causing their back to arch. And the
Wow.
arch is what's hurting their body.
Yes.
Does that make
So
sense?
interesting. It makes tons of sense. So I'm trying to make it overly simple for people, maybe, but if you stand like me, maybe put an alarm on your calendar for every 15 minutes just for the first day or two. Say, unlock your knees, or put a post-it note on your computer, unlock your knees, because I'm sure it takes conscious effort, at least at the beginning. So we need those reminders, and then hopefully it becomes pattern and habit.
I'll give you an even better way. This is what I
Great.
do with my patients in the clinic. I put a little piece of athletic tape on the backs of their knees.
Oh, okay.
And so whenever they lock their knees, that tape tugs on them and they get that input. And so they don't have
Great.
to rely on setting alarms or anything like that
Perfect.
every step of the day. So if you have back pain, and back arching is part of that pattern that's causing your pain, and you take 10,000 steps a day, and now you stop
Yeah.
locking your knees when you're doing that, that's
Mhm.
removing 10,000 hammers on your back.
Yes, I can
The
see that.
problem isn't your back, it's
Right.
your legs and how you're
Yeah.
walking, right?
Yes.
And so this is
Yes.
what I've found a lot of people don't understand, is that really it's everything that's working on the back that's the problem. The back is
Yes.
just the recipient of all of these stressors.
Yes. So interesting. So we have the side bend, we have the arch. Was there a third one, or was that three?
There is a third one. The third one is very rare, though. I probably
Okay.
run into one person a year
Oh,
with this type of problem, so it's not really worth. I would guess, like I said, 99% of the people. Oh, and you can have both of these happening together. So
oh,
often sciatic pain is a combination of the excessive arching and the side bending, which you can
okay.
imagine just devastates the low back area.
Yes.
Very easy to
Absolutely.
solve, though. Very easy.
Okay, amazing. So we're talking about standing and unlocking our knees. Let's talk about standing and sitting and posture and all of that. You've probably seen me when I'm standing, I like move around a little bit. It just happens. I don't really know why. It feels good. And I also try to stand about 2 calls and then sit 1 call. So I'm alternating. Again, I don't know if this is right. I'd love to hear your thoughts on posture while we're sitting, how to alternate sitting and standing, any of that for those of us who work at a computer.
Yeah, well, I don't care if you have the absolutely most perfect posture, in the world, and you're holding that posture for more than 5 minutes, your body's going to get achy. I don't care
Ah,
how good it is. So
okay.
the body needs some type of movement. It needs to change things up because tension is generated holding that posture.
Yeah.
And then that tension compounds. And so it needs variety to get that pressure off of those pieces of your body that are aching because of it. So
Yes.
you're standing right now, and I think you're standing with both feet in parallel.
I am, yeah.
Right.
But
So
sometimes I'll like go all over the place, and then I'm like,
yeah,
oh, my hip is jutting out. I need to stop that. So
right. Yeah.
tell me.
So you're pretty tuned into your body, but if you simply just put one leg in front of the other by about 3 or 4 inches,
Okay.
and now load up the front leg. There you go. And that
Okay.
knee will automatically unlock.
Yeah.
Right. So
Interesting.
now we're using that one leg that's forward to hold you up. And that's your body, your back loves that.
Okay.
Right. And so you
I
can also do
never
that
stand that way.
right. And so if you just switch periodically like that,
Okay.
that will change the stresses on your back significantly. So
Great.
a lot of people they've bought those standing desks thinking
Yep.
that that's going to solve their pain. And then they find out that it doesn't.
Yeah.
Well, we have to change how you're standing if you're going to be using the standing desk, changing from a parallel stance to a staggered stance.
Yeah.
And maybe even just, I mean, you've seen the supermarket checkout people, they have a little stool that they put their foot up. That's even better because that introduces even more flexion into the hip and removes more forces tugging that pelvis forward, causing the back to arch. So get creative and start using that kind of stuff.
That's great. I love it. And then what about if we need to, or if we just do sit? What are some tips for that?
Yeah, so if you look at almost every ergonomic diagram on the internet, you'll see that everything must be 90 degrees, right?
Yep.
That's not the way we're built, though. So
Okay.
if you have an extension problem, which means that your back is too arched,
Mm-hmm.
then most chairs for most people are too big.
Okay.
And so what happens is that the knees then are resting below the hip joint. Their feet
Okay.
have to try to reach for the ground, right?
Yep.
Well, anytime those knees come down below the hip joint, it's going to tilt the pelvis forward,
Okay.
which then causes the back to arch.
Yeah.
And we just found out that back arching is one of the things that hurts your back.
Yes.
So what I recommend for people, some people are in deeper holes of back arching than others.
Okay.
So what I do is I have these little telephone books at the clinic, and I have people sit down, and then I have them put their feet on top of the telephone books. How does that feel? Oh my gosh, that feels so much better. All right. Well, that's just one telephone book. What if we use two? That's even better. Oh my gosh, I can't believe it. Or no, I think one is enough for me, you know? But if you're not using the back of your chair to support your trunk when you're doing this, then all that's going to do is push you back. And then you're going to engage all of these muscles to try to sit up straight, and it's going to cause more tension.
Interesting.
So what I have people do is that I just say, hey, bring a couple pillows in from your bed at home, put them lengthwise behind your spine, bring the back of the chair to you. Wherever you're sitting on that chair, bring the back of the chair to you so that you have some support, and this will signal your back muscles that they can let go. Because when you're sitting without that support, they can't let go. They have to hold you.
Right.
And they're holding you up in an extension pattern, problem. So if you're going to lift the feet up, then you have to have something behind your back to help catch that. And I had a woman cry one time. She was she couldn't believe that she could sit without pain. And it was, these things, she just never thought to experiment with anything. And so anyway, we could go in more.
That's
but
incredible.
There's a lot of ergonomic issues to solve neck pain and headaches too that people can enjoy. So
interesting. I have this foot massager under my desk, and I rarely actually use the massager, but I've always kept it there because I rest my feet on it. And I kind of thought I was too lazy to move it, but maybe it just feels better on my back. I'm going to experiment when I'm sitting and I'm resting my feet on top of it.
As long as you have support behind your back.
Yeah.
Because the higher the knees come, the more it's pushing you back, right?
Yes. Interesting.
Yeah.
Okay.
And so the ergonomic charts that you see online don't allow the knees to come up above hip joint height.
Yeah.
But sometimes that's exactly what people need to offset this whole pattern that they've developed in their body. So break those rules.
Okay.
Experiment.
We're breaking the rules here. I love it. You mentioned briefly headaches, and you told me before we started recording that's probably the one of the two most common things you see. So I'm sure they're multifactorial like everything, but for someone experiencing headaches, where would you start?
I'll tell you, it's simpler than you think. All
Okay.
right. So if you look at the architecture of the body, and if folks at home are listening, and you can Google the body, Google the skeleton, and you'll see that we have in our pelvis these broad, flat bones. All right. But all the rest of the bones are long bones.
Mm-hmm.
So we all know that the pelvis is the center of function for our lower body, pelvis, and back. All right. Similarly, the only other place in the body that has a bone like this is our shoulder blades.
Okay.
And the shoulder blade is the center of function for our whole upper body system.
Okay.
Okay. There are large muscles that control this whole thing, and they attach into the neck and the base of the skull. When there are problems with how the shoulder blade is moving or resting, force is transmitted via these muscles into the neck and the base of the skull.
Mm.
One of those little muscles is called the levator scapula.
Okay.
Levator means elevate.
Okay.
Scapula is the shoulder blade.
Okay.
And it starts right here at this inner corner of the shoulder blade and inserts into C1 through 4. Well, almost everyone, when they point to their neck, they say, oh, it's killing me right here.
Yes.
Well, they're not pointing to their trapezius. They're
Ah.
pointing to the muscle deep to the trapezius, which is this levator scapula. All
Mm.
right. And it's because it's trying to hold up this whole system,
Yes.
because the muscles that are supposed to be doing this aren't. Okay.
Interesting. Yeah.
So this then causes stress to these neck muscles, and the nerves pass through these muscles that go to the top of the head, which then cause migraines, tension headaches, and so forth. I can't remember the last person I treated with for headaches that this wasn't the cause of their chronic pain. So
Wow.
I'll give you a really easy way to determine if this is the case for you.
Great.
All right. So if you have headaches, you're going to be the recipient. All right. And what I want you to do is just stand there, or if you have neck pain, you're just going to move your head around, look over your both shoulders, look up, look down, and get a sense of how much your neck hurts to do this. The
Okay.
limited range of motion, the tightness, all that discomfort, excuse
Okay.
me, that you might have. Okay. Then you're going to have someone stand behind you, and they're going to put their hands in your armpits,
Okay.
and they're going to lift up your shoulders about a half inch or an inch higher.
Okay.
And they're going to jiggle your shoulders around a little bit to make sure that you're relaxing. And your job is to relax your shoulders into their hands as much as possible. This takes maybe 15, 30 seconds, something like that. Then you're going to move your head over each shoulder again, look up and look down. And I will almost guarantee that your range of motion will increase and your pain will decrease when their hands are holding up your shoulder blades.
Wow.
And what
Okay.
that's telling you is the problem is coming from the shoulder blades,
Mm.
not neck. The neck, like every other area of the body, is the vulnerable area. The
Yeah.
shoulder blades are the culprit.
Wow.
Very simple.
So let's imagine that people try that. They have someone put their hands under their armpits, wiggle around, they have more range of motion. They know the problem's coming from their shoulder blades. Is this a process of strengthening the right muscles, or what's the process that you teach people?
Okay, so I may geek out just a little bit on this.
Okay.
Okay, so the most common what you've just determined is not only that the problem is from your shoulder blades, but that the problem is that your shoulder blades are resting too low.
Okay.
There are rules about how the shoulder blades should be resting and moving. The purpose of the shoulder blade is to assist the arm in moving overhead. A
Okay.
lot of people with chronic neck pain and headaches, it's made worse when they use their arms.
Mm-hmm.
And this is why, because the foundation of that arm movement isn't working.
Yeah.
Okay. So an easy thing to do, we were talking about ergonomics before.
Yep.
So let's go back to our chair again.
Okay.
Okay. So if you're sitting in your chair, I'm going to put this guy down, and I'm going to step back so you can see my arms. So when you're sitting in your chair, your arms should be at the seam of your shirt, and
Okay.
your elbows should be resting at roughly 90 degrees.
Okay.
Wherever your hands are at that point is where your keyboard should be.
Okay.
If your keyboard is further forward,
For sure.
you've just lost all the support
Ah,
that you were getting when your arms were here. And now
interesting.
what you're doing is engaging the shoulder and neck muscles to hold up your hands
Mm,
instead of yet letting whatever your chair hold up your hand.
I am highly confident this is part of my issue. So thank you. For
Yeah,
anyone who can't see Rick, like he said, his elbows are by the seams of his shirt. So meaning like by the side of your body. They're
correct.
tucked in as if your hands were down to your sides, but then he just bent his elbows up, and that's where our hand should be. That, I venture to guess, is way closer for a keyboard than most people are using.
Absolutely.
Yeah?
Absolutely. And so here's
Interesting.
the other thing. You know, we were talking about chairs not being the right size for a lot of people.
Mm-hmm.
So often the arms of the chairs can't come in close enough to support the elbows in this position.
Right.
And so the elbows have to reach out to the sides a little bit to rest
Mm-hmm.
there. Well, when they reach out to the side, now you're reaching down to get to that armrest.
Yes.
If you remember, the most common problem with shoulder blades is that they're resting too low.
Yes.
So now you're actively pushing them down by trying to reach into that armrest. So
Mm-hmm.
what's the solution? I have people, again, bring in some pillows from their bed at
Yep.
home, fold them in half, and shove them between your body and the arm of the chair.
Ah, okay.
Those will naturally bend at about the right height for most people. You should feel like your shoulder is resting about a half inch to an inch higher, just like that
Okay.
armpit test we did before.
Yeah.
And if they're resting there, then you know you're at the right height. And then
Interesting.
move your keyboard to you. Make your workstation fit you rather than you fit your workstation. So move
Yes.
that keyboard, whatever it takes to get that closer to you, get it there. Now, I once saw the guy's 20 years of neck pain because his mouse was too far away. He did a
Oh,
lot of
wow.
mouse work. So all we did was we brought his mouse closer to his body, pain gone instantly. All right.
That's amazing.
So if you do a lot of mouse work, what I tell people to do is, hey, slide that keyboard over and bias your, let's say you do mouse work with your right hand.
Yeah.
Scoot the keyboard to your left and put that mouse closer to the center of your body on the
Yeah.
right. Now you're not reaching at all for that mouse.
Mm.
Try this for 2 or 3 days, and I will almost guarantee that your neck pain and headaches will diminish significantly.
This is so exciting. I am definitely going to employ some of those tips. I always thought it was just I was doing push-ups wrong or something like that, which could be part of the problem as well. But I think I am confident my keyboard is way too far away from me. So this is great.
Yeah.
Thank you.
Well, if you don't mind, I'm going to go into some programming and training that we've all received
Sure.
that's at the root of this kind of problem.
Great.
So you mentioned that you do a lot of different types of training,
Yes.
right? And do you go to yoga or Pilates?
Yes.
Okay.
Both
Have you ever heard the cue to bring your shoulder blades down and back into their opposite back pockets?
all the time.
Okay. Now, what do you think of that cue? Now that you know that our shoulder blades resting too low is the most
Yeah.
common problem causing most chronic neck pain and headaches. What are
I
your
feel
thoughts about that
nervous.
cueing? Exactly.
I
But
know
it
I
is the
can tend
exact
to scrunch
opposite.
my shoulders up, which probably isn't right, but pushing them far down sounds like the wrong thing to do. We need
Yes.
what you said, maybe slightly higher than I think is normal and pulled in as opposed to back and down.
Right. So that is causing the shoulder blades to be trained to sit lower,
Yeah.
which is then now your shoulders may not actually be resting too high.
Okay.
You may feel like they're resting too high because if you remember that levator scapula, it's a little pinky muscle
Hmm.
trying to hold up this whole system.
Yeah.
The whole system weighs about 20 to 25 pounds.
Mm.
Now, the muscles that depress the shoulder blades down lower are very large and powerful, like the latissimus dorsi and the lower trapezius fibers and things like that.
Okay.
So you've got these massive muscles trying to pull a system that weighs 20, 25 pounds down in addition to gravity. And you've got one little levator scapula trying to pull that up.
Mm. Yeah.
This is why people think that their shoulders are sitting up here, is because their levator scapula is trying to fight this whole
Right.
thing. It's not that your shoulders are resting too high. It's that that little muscle is working too hard to
Yeah.
try to offset all of this problem.
Interesting.
So
Makes
we're
sense.
approaching posture exactly wrong
Yeah.
when we're using our shoulder blades to do it. And I can show you what I think is the right way if you want.
Great. Yes.
All right. So whenever you find yourself having chronic pain, the important thing is not only to understand why it's happening, but to stop digging your hole.
Mm.
In terms of neck pain and headaches, you're digging your hole whenever you bring your shoulder blades down and back into the opposite back pockets.
Right.
Okay. So, but we're taught to do that in order to create lovely posture.
Mm-hmm.
But that's not, our shoulder girdle isn't designed to create lovely posture. So that's just something that's bled over from, I believe, the dance community. And it's
Okay.
bled over into gymnastics, yoga, and Pilates
Yes.
because we all really like this long neck look. We think that
Right.
that's a pretty look, but that's not a functional look.
Right.
So here's how you should actually be doing posture.
Okay.
So if you put one hand on your chest
Okay.
and the other hand on your belly, and everyone at home do this because when you feel it, you'll know the truth. So take a deep breath in and you'll feel your rib cage lift. And then when you exhale, you'll feel your rib cage go back down again. Can you feel that, Megan?
Yes.
Okay, so inhale again, rib cage lifts. This time when you exhale, don't let the rib cage go down all the way. Let it go down 99% of the way, but not all the way. And you can exhale all the way though.
Okay.
But just keep that rib cage up a little bit. And what you may have noticed is that your stomach just engaged ever so slightly when you held your rib cage up.
Yes.
This is your core holding up your posture. This is
Okay.
what the core is designed to do. That's why the muscles are so huge and they go all over the place. Is that they're made to hold up the rib cage. Now, the second part of this is if you bring your arms down by your sides and you jiggle the shoulders around to relax them, because they should be like two loose dangling ropes.
Okay.
And you'll find that when you finally relax those shoulders, you've also relaxed your core.
Okay.
And the reason is because you've tied posture strategy to your shoulders instead of core.
Interesting.
So the goal is to lift the rib cage ever so slightly using your core will activate naturally to do this, just like it just did. You didn't have to think about activating your core. It's going to do it all by itself and to whatever degree is necessary if you just hold the rib cage up a little bit. And then the second part is to relax the arms and get you to stop using your shoulders to create posture.
Okay.
And train your core to create the posture instead.
Okay.
This will solve a lot of pain.
Interesting. So in those same classes, those same Pilates classes, when they say, engage your core, that's good advice. We engage our core from the sense of that slight natural chest lift, and engaging the core is fine. It's just the shoulders down and back that's not the fine part. True?
Yeah, but kind of true. Getting close. Because if you're just standing there and I said, now engage your core,
then I might go like this or something.
Exactly.
Squeeze.
You're not having the rib cage trigger the core to engage.
Got it. Okay.
You're consciously engaging it, which if you're consciously engaging your core and then you see a pretty bird or a person across the street, you forget about your core.
Right.
Right.
Okay.
And now it's disengaged.
Yes.
If you just learn to lift your rib cage ever so slightly, that'll become a habit, and you don't have to worry about whether your core is engaged or not, because it's going to engage naturally. Most people err on the side of too much core activation.
Okay.
I've done this 100 sit-ups a day, for a reason,
Yeah.
And no, I never give any core exercises to any of my patients. I just teach posture correctly. That's all the core strengthening they need. If they go through life with the correct posture strategy, then that's going to strengthen their body for them.
I love it. This is amazing. So it all comes down to just learning how to use your body correctly and not the way that we've been conditioned to use it. This is making so much sense. I have a few other tangential questions for you. One is about sleep. Sleep is a tough one for chronic pain because chronic pain can inhibit sleep, but also sleep, I think, can help the body heal. I'm always curious to hear people's opinion on the best sleep position. So could you tell us that, and then any other things about sleep you want to mention?
Sure. And I agree with you. Sleep is where we repair.
Yeah.
And, you know, it's interesting the way that you phrase that because chronic pain isn't its own entity.
Mm,
There is a cause for your pain.
yeah.
And we've been talking about a lot of those causes.
Right.
So, what I would say is understand why you're having chronic pain first,
Mhm.
right? So, fix the body that's going to bed, and you won't have to worry about sleep so much.
Right. Love
But
that.
my overall belief is that everyone has a natural way that they like to sleep, whether it's on their stomach, side, back, whatever. My belief is that we sleep deeper when we're sleeping in our naturally comfortable position, whatever that position might be.
Okay.
And so I always try to get my patients back to whatever that natural position is because I know their sleep will be deeper.
Okay.
If that requires pillow positioning and so forth to do that, then we're going to do that because they're going to wake up so much more rested
Ah,
and clearer because of it. So that would be my recommendation is try to get back to the way your natural way of sleeping because I get a lot of people who said, "Oh, I was told never to sleep on my stomach, so I sleep on my back, but I just toss and turn and blah blah blah." Well, let's get you back on your stomach then, and I show them a way to do that, and they can sleep pain free, and they're just like, "Wow, I feel so much better just sleeping more,
ah,
deeper." And so that would be my general recommendation for sleep.
so interesting. I laugh at myself because I think it's kind of funny. I can only sleep on my side. So it must be my natural position. Either side doesn't matter, but I sleep with a pillow in between my knees and then a pillow on my back, a pillow under my head, and then I hug a pillow. And then I hear some of these people who are like, sleep on hardwood, like no pillows, no bed, nothing. That's the best for your body. And I'm like, oh no, I'm slowly killing myself. So you've given me some reassurance that whatever feels natural and gives me the most rest is probably the best. And I sleep great this way, honestly. I feel
Yeah,
no issues at all, but it
which is the
sometimes feels
function of
high
sleep,
maintenance.
right?
Yeah.
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 So your body knows. You already
Okay.
know how you should be sleeping.
Okay.
You don't need me
Good.
to tell you.
Thank you for that. Well, let's talk about some treatment options and your programs. You can wrap everything up into however you want to answer this question. But what are some ways that you advise people to reduce pain that probably isn't just pop an anti inflammatory pill or something like that?
Well, like I mentioned earlier, most people have been around the block with a lot of different practitioners.
Yes.
And so my first recommendation is always go to your doctor, have them run whatever scans they want. They'll send you
Yes.
to whatever specialists you need to go to.
Yes.
And if you've already been down that road and you haven't had any real relief, then it's because I believe they've been looking in the wrong place.
Mm-hmm.
And again, it comes down to this component thinking idea that they're looking too narrowly at your body. And it's very easy to get an MRI of your back with disc bulges or herniations or stenosis and say, "Oh, that's your problem."
Yes.
No, that's the vulnerable part of your body.
Yes.
The problem is elsewhere.
Yes.
So changing your mindset to think bigger
Mm-hmm.
is where I would first start thinking if you've been down all of those roads. Um, the At the risk of sounding like I'm just trying to sell something, my
No,
home
please.
programs are about fixing the body as a system.
Yes.
Now, a lot of pain is happening because of chronic tension in the body. And we kind of talked about that at the beginning. That tension can happen because of how we're using our body improperly. It can come from things that we're ingesting that's causing an inflammatory response. It
Mm-hmm.
could be emotional or psychological trauma. And what happens with that tension is it happens in patterns in the
Mm-hmm.
body. And contraction then occurs along these patterns. And these are large patterns that range from the head to the foot. And my home programs address these patterns of tension for the most part to fix the stressors that are maybe working further away from your body to relax the whole system so that it can function better. It also, of course, goes into changing the habits that are causing the patterns to happen. And it also corrects the tighter, weak muscles that are occurring because those patterns are happening too. And then I also have taping recommendations in those because sometimes our bodies need support before we can control it correctly. And the tape kind of brings people out of pain immediately, so they can see where the real problem is.
Really interesting. So can you tell people you have 5 programs, right? Or 5 books? 5 programs or 5 books?
6 books, 5 programs, and another book coming out next year.
Okay, so about to be 6 and 6. I can't imagine having 12 children, but let's just say this is like choosing your favorite child. What's one that you would guide people to start with, or is that too hard?
Yeah, no, not at all. The home programs are targeting different areas of the body. So I have one for back
Gotcha.
and sciatica, one for hip pain, one for knee pain, foot pain, and then one for neck pain, headaches, and shoulder issues.
Perfect.
So you could just choose whichever one you want on that.
That's wonderful.
And I recommend them over the books that I wrote 10 or 15 years ago, because since then I've owned my own clinic, and I've seen that these issues that I describe in my books are happening in patterns in people. And so my programs address the patterns of things that are happening in most people. So a pattern of dysfunction in me would cause me back pain in me, but it might cause sciatic pain in you, or SI joint in another person, but
Yes.
they're all the same patterns.
Yes.
It might cause a disc bulge in one, or stenosis in another, spondylolisthesis in a third, but they're all the same pattern that's driving that issue. Does that make sense?
Understood. Yes, this is fascinating. I definitely am going to check out the program on neck area, shoulder, neck, whatever the title is, but I'm very excited to check that one out for myself. And I know that the audience will be as well. So we'll include all of Rick's programs and books and website in the show notes, links to that. I highly encourage people to go check them out and to follow Rick on social media, check out his website, all of that kind of stuff. You've shared so much valuable information with us today. I really appreciate your wisdom and insight. Thank you so much for coming on, Rick.
It's been a pleasure, Megan. And let me just give you one more tip.
Please.
If you type in Fixing You, all one word, FIXINGYOU in the coupon code, you'll get 20% off of all of my products.
Woo, awesome. So Fixing You, all one word, for 20% off. That's great. Thank you for that offer.
Sure. And people can read some chapters from my upcoming book on my website too.
That's great. I look forward to it. Well, keep on doing the good work. I can tell you're prolific and helping a lot of people, and we all appreciate it.
I appreciate you too, Megan. Thank you so much.
Thank you.